Once again, I'd like to touch on some basic maxillary anatomy before we look at a CT scan. As you can see on the left here, the maxilla is highlighted in green. When it comes to the maxilla, you can think of it as having different processes or parts. For example, here we can see the alveolar process inferiorly. This is what houses the teeth. We can see our zygomatic process here that goes towards the zygomatic bone. And we have our frontal process here that extends towards the frontal bone. As you can see here, the infraorbital foramen are seen bilaterally. This is where the infraorbital nerve exits. Looking at the maxilla from the inferior, we can see our alveolar process housing the teeth, as well as the hard palate. Here we can see a suture line running in the middle of the hard palate, which we'll examine later on the CT scan. As well as, most importantly, in the posterior, you can see the medial and lateral pterygoid plates. These are extremely important when diagnosing a Lefort fracture and is something we will greatly emphasize when reviewing the CT scan. Now that we've finished analyzing the mandible, let's move on to the maxilla. First off, I just want to say the maxilla is one of the most difficult aspects of the CT scan to analyze, and in addition, there are many fractures that can go undetected on a CT scan when it comes to the maxilla. That's why it's always important to correlate with your clinical findings and perform a thorough maxillary exam to detect for possible Lefort fractures that you won't be able to see on a CT scan. Where we last left the mandible, there was a junction between the mandibular teeth and the maxillary teeth as shown here. This is where you begin your analysis of the maxilla. As you scroll up through the scan, you'll be able to analyze the maxillary teeth and their roots, and the maxilla will come into form. The same principles that apply to the mandible will apply to almost every other bone we analyze in the face. You'll always be looking at the cortices for a smooth outline, checking for any breaks, but always correlating with your known anatomy. The first part of analyzing the maxilla is examining the alveolar processes themselves. As you're scrolling through the teeth, you'll be able to see breaks in the cortices that may represent an alveolar fracture. Right away at the anterior, you can see this divot in the maxilla that eventually, as we scroll up, forms a hole. This is an example of correlating with your known anatomy. As you can tell, this hole is posterior to your two central incisors, and as you guessed, it represents the incisive foramen and is a normal structure that you'll see. As we continue to scroll through the maxilla, we'll get to the bony flat plate as you see here, as well as this line right through the middle. This is an example of normal anatomy and represents a suture line, as the right and left processes of the maxilla fuse during its formation and form the suture line along the middle. Although this may look like a fracture, once again, this is normal anatomy and can be expected to be seen, especially in younger patients. As we continue to scroll up, you'll see these two large radiolucent cavities on either side. These represent the maxillary sinuses. One of the most common fractures you'll see on a CT scan are fractures of the walls of the maxillary sinuses. This is because they are extremely thin and are often fractured during any kind of trauma. Another clue is when examining the sinuses, if you see a radiopaque fluid material within, this likely could represent blood, indicating trauma or fracture to a surrounding bone or area. Analyzing the sinuses is the same as everywhere else. It's important to scroll through them one at a time on either side, examining the cortices for any breaks or step-offs. Keep in mind the sinuses can have lots of septa, vascular channels, and other pathology, so it's always important to correlate what you're seeing with other clinical findings in the patient's history. As you scroll up in the sinuses, you'll see these foramen on either side. Correlating with your anatomy, you'll know that on the superior aspect of each maxillary sinus, there will be the infraorbital foramen, and as you continue scrolling, this will become the infraorbital canal. This area is now the orbit, but it's important to scroll all the way up to finish looking at the sinuses on each side until they disappear to make sure there are no fractures within the maxillary sinuses. In this example, we do not see any fractures in the maxillary sinus. Finally, one of the most important and yet most difficult aspects to examine when it comes to the maxilla are the pterygoid plates. Remember, you cannot have a Lefort fracture, that is Lefort 1, Lefort 2, or Lefort 3, without fractures at the pterygoid plates. The pterygoid plates are visualized posterior to the maxilla on both sides. In the axial view and later on the coronal view, you're able to visualize both pterygoid plates and able to see if there are any fractures. Here we can see our medial pterygoid plate and our lateral pterygoid plate. Once again, the medial pterygoid plate and the lateral pterygoid plate. As you can see here, there are smooth cortices in the plates, no fractures, and no obvious deviations. These pterygoid plates appear to be intact. Starting from one side, you'll immediately see the maxillary sinus come into view. As you can tell later on, this will be a great view to analyze orbital floor fractures. However, when it comes to the maxillary sinus itself, analyzing it from the axial view is usually much more useful. One advantage of the sagittal view, however, is when it comes to dentoalveolar fractures. Because you're seeing all the teeth in the alveolus in the sagittal plane, you're able to visualize alveolar fractures in great detail, as well as tell where they are relative to the teeth. Just remember you have to scroll through the entire scan on both sides to examine both sinuses and all the dentition. Finally, using the sagittal view, you're able to tell if fluid or a radiopaque substance that you see in the sinus is likely to be fluid such as blood, or maybe pathology such as a cyst. Remember, fluid such as blood will always follow gravity and usually forms a straight line across the sinus of radiopaque material, whereas a mass or a cyst can form a dome-like structure and doesn't necessarily need to follow gravity. This is one helpful way of determining what you're looking at in the sinus. Similar to the sagittal view, the coronal view for the maxilla is also a little bit difficult to analyze, but can provide some very useful information. Starting from the front of the patient's face and scrolling more posterior, we begin to see the central incisors and anterior maxilla come into view. As you can tell, once again, this view would be very good for dentoalveolar fractures, as you're able to see the teeth in the coronal plane as well as the entire alveolus. It's also good to look at the sinuses from this perspective, as you can visualize any fractures you know about from a different view. Other than dentoalveolar fractures, and even dental fractures, the coronal view is great when it comes to the maxilla for one more point. Remember in the axial view how crucial it is to always look at your pterygoid plates. However, sometimes it can be very difficult to tell if there's a step off or a fracture in them because they are so thin. A great idea is to visualize them again in the coronal view. As you scroll all the way posterior, the pterygoid plates will begin to come into view in the coronal view. Here you can see your medial pterygoid plate and your lateral pterygoid plate on each side. If you're ever concerned about fractures in the pterygoid plates, you can always pull them up in two views, using your axial view and your coronal view at the same time. Here we were visualizing them in the axial view, and as you can see, sometimes it's hard to tell because they're so thin. However, if you look at the same time in both views, especially the coronal view here, you should see a nice smooth outline, and it's much easier to tell if there's a fracture in your pterygoid plates. In this scan, once again, we don't see any evidence of a pterygoid plate fracture. The last area I want to mention is the piriform area. It's very important when examining the maxilla to look at your lateral piriform rims here and here. In a Lefort 1 fracture, you may see a fractured line through the lateral piriform rim on both sides. This fracture line may extend posteriorly, starting with your lateral piriform rim, then going transversely above the maxillary teeth in the alveolus, just under your ZM junction, and then more posteriorly through your pterygoid plates, as we discussed previously. Always make sure to examine this lateral piriform area on both sides whenever doing your maxillary assessment.